For many of us, we don't make a decision. We don't actually sit down and say, you know what, I think queer people are evil and I have a personal responsibility to ensure that they suffer on earth. But because we aren't questioning and interrogating the rest of the system around it, that system that asks you, are you sure that you're not pregnant? Or are you married? Where is your boyfriend? Etc., etc., making all of these assumptions about people because we don't question that, because we insist on fixating ourselves on details like legal names and assigned sex at birth and whatever else. We are perpetuating this cycle of violence, and we're telling patients who should be able to trust us with the most intimate details of their lives, patients who should never, ever, ever have to question whether they're going to be safe seeing a doctor, they do have to ask that question. And it's an indictment on us. I think we can understand why this is an important subject and why it's something that we all have to be aware of and we all have to participate in, because there is no passive option here. If you avoid the conversation or you don't have the conversation, it means that you are upholding a system that already exists, a system that is violent and that is discriminatory. So there's no opting out. You can't be on the fence, because being on the fence means that you're okay with a system that is abusive.
It is incredibly important for students to understand that they're going to be seeing patients all over, and you are not going to be able to choose the kind of patients that you see. And it is our sworn oath to give the best care possible to the person who's sitting in front of us. And if someone doesn't feel safe disclosing something that may be of absolute material importance to potential differential diagnosis, then we have failed them, and that's not acceptable. So we really do have to think about where our own preconceived ideas and judgments and notions come from, and think about how we would navigate that in a situation where we do come across a patient who doesn't come from the normal category of not LGBTQIA+, because it really has a massive impact on health-seeking behavior and outcomes and all the health parameters that you can think of, really.
I mean, it's absolutely right. I graduated in 2009, and I did community service in Barberton. It's next to one of the country's maximum security prisons. You know, we used to get prisoners coming into the casualty department all of the time with complaints, chronic diseases, acute infections, injuries, you name it. And, you know, we never asked the question, what did this person do? Why are they incarcerated? We never asked, because we knew that we have a responsibility to treat everyone as a human being and not to bring any of our own personal judgment into it. So whether this was someone who was arrested for robbing from the rich and giving to the poor, or whether it's someone who was arrested for beating up puppies or doing unspeakable crimes against humanity, we didn't know, we didn't ask. We treated them as a human being. Now, that I even have to draw this comparison in 2020 is shocking. The people who are LGBTQIA+ have committed no crime whatsoever. They have committed no crime. We're talking about people who either love other people or choose to love themselves, which are all basic human concepts that we all understand. You know, love is a good force in this world. You don't have to explain that to a child. So we take a group of people whose only crime is who they love, or choosing to love themselves, or being true to themselves, and we somehow convince ourselves that it's okay to decide what degree of access, how much respect do we afford them, how much safety do we afford them. It's not our role as healthcare providers. Even if you do have a problem with people who you see as different, it doesn't entitle you to bring that prejudice or that discrimination into your clinical practice. That's something that you have to reconcile for yourself, but professionally you are bound by a moral code, a responsibility, an ethical responsibility to treat everyone to the best of your capacity and not to be violent towards them. And I think that this is one of the concepts that is really, really so important to understand, because I know that when we sit down and we talk about gender and sexuality and cis versus trans and heterosexual versus gay and whatever else, I know that some of these concepts can be challenging for some of us. And often it's not because of decisions that we've made, but it's because of the way that we grew up and how we were conditioned and socialized and what we absorbed from the media, what we absorbed from our parents, what we absorbed from our schools or our social circles. But even if we have issues around whether we agree philosophically or religiously on whatever axis or not, it doesn't entitle us to make a judgment. That's not our role as healthcare providers. We have to leave all of those preconceptions at the door, and we have to be the best clinicians that we can be. So certainly I would say that if you do have a problem with anyone on the LGBTQIA plus spectrum or under that umbrella, then it's worth unpacking it and asking, why are you threatened by this, and seeing where that comes from. But regardless of whether you do the introspection or not, it is a conversation that we have to have, that we as members of the healthcare profession cannot abide by our colleagues or our future colleagues endorsing practices that are harmful or detrimental towards patients. And I think what I want to put out there is that when it comes to dealing with concepts like this and people who are part of the LGBTQIA plus community, we have a tendency to try and avoid the discussions. And that tendency can come from a number of different places. And often I think it comes from an uncertainty. We don't understand, or we don't know, or we're afraid that we're going to use the wrong language, or we just don't know how it works. And what I want to say, as someone who does identify as a number of these different flags and labels herself, what I can say is that when you move through society as a queer person or as an LGBTQIA plus person, you become very, very adept at determining whether malice is present or not. Because I can tell you, I have faced all kinds of invasive questioning from all angles. Sometimes it's good-natured and people just don't know better, and sometimes it is very hurtful and very malicious. And we do become very proficient at telling the difference between the two. If you don't know the correct pronouns to use for your patient, you don't know what name to address them by, you're allowed to ask. It's okay. You don't have to get everything 100% right all the time, but your heart has to be in the right place. So if the questions that you ask are because you're curious and you want to know what's in someone's pants, you want to know who they're sleeping with, just because you're ticking your own boxes and you're fulfilling that need for gossip and scandal in your life, that's not okay. If you have a sincere question that comes from a good place, you're entitled to ask it, and the majority, if not all of your patients, will be happy to answer you, recognizing that you're showing a desire to understand better, to learn more, and to interact with them in a way that is ultimately more sensitive and more respectful.
I agree, and I think the key message is that we don't expect you to know everything about this topic. We expect you to be sensitive and switched on, and you know, if you don't know something, you invent an excuse to leave the room and you go look it up. You know, you've got the internet at your fingertips, but it's just about being sensitive and respectful to every single patient who walks through your door. We don't expect you to know everything about this area because it is vast. And if you approach it with sensitivity in any sphere of medicine, if there are difficult questions to be asked, provided the patient understands why you need to ask and that you do need to ask, they will answer, but they've obviously got to be asked for a good reason and a valid reason.
I just want to know that when you all who are watching this, when you graduate, I want to know that I can be safe and confident in referring all of my patients to you, that you'll treat them with dignity and respect, and that they will give absolutely glowing reviews of this UCT class. They'll say, this is a group of doctors who went out of their way to do better and to grow and to learn and to really reach out to the people who need it the most and stand up for those who are marginalized, who are oppressed, And to recognize that your responsibility as a clinician means that you also have a responsibility to uphold human rights.
Bravo. I got goosebumps there. Fantastic. Thank you so much for your time.